Okay. Thank you, everyone, for joining us today. I'm Ed Stellan, and I'm the Chief External Affairs Officer here at the Illinois Public Health Institute. Thanks for joining us today for this celebration. It's a celebration and a reflection on the CIE's first year of development, where we really want to especially take some time today to thank all of the folks who helped us craft, learn the landscape, craft a vision, and really build a plan for implementing the community information exchange. So what I'm super excited about is that every step of the way, people with lived experience were involved. They committed a lot of time and a lot of thought into what we were doing. Um, so for me, the CIE is so groundbreaking. It really allows us to network together to achieve better health outcomes. And it is important now more than ever before. Right now we're stronger together. Our services are better when they're coordinated. And when we use our services and our resources more efficiently through collaboration, we're all stronger for that. So I'm just going to say a couple things about logistics here. The Q&A feature is activated. We're not going to be answering questions during this session, but if you put any questions that you have in the Q&A function, we will we will develop an FAQ form and share that with everyone. If you have any technical issues, you can message Adrian Blasi at adrian.blasi, B-L-A-S-I, at iphionline.org. So the Q&A function is kind of in the bottom of your screen there. And I'll remind you at the end, but if you go on the CIE website and sign up to be part of the CIE newsletter, you will definitely be able to get access to the recording and FAQ from this session. So I'll be joining you again a little bit later, but right now I'm going to turn this over to Crystal Tyler, CEO here at IPHI. Crystal.
Thanks, Ed. Hey, everyone. Welcome to the celebration session. We are so thrilled that you came to spend some time with us. We are excited to celebrate the CIE, and I can't wait to hear more from the incredible team that we will have. So as Ed mentioned, I'm the CEO of the Illinois Public Health Institute, Crystal Tyler. I use she, her pronouns. And for those of you who are not familiar with the Illinois Public Health Institute, or IPHI, we advance health justice through equitable policy systems and institutional change. And at IPHI, we are thrilled to house the Chicago region-wide CIE, which is led by the incredible team that you see here. So in the current context, and Ed mentioned this, you will hear this furthermore on the call, it is really, really, really important that we continue this work to address the increasing prevalence of these complex, interconnected health-related challenges related to housing, food insecurity, chronic disease, and others. And we really look forward to partnering with you on this journey as we move forward. So with that, I would like to introduce Waldo, who directs all of this incredible work. He serves as our managing director for the CIE. Waldo.
Thanks, Crystal. So as you all heard from Ed, this is a celebration webinar, and it's really designed to thank all the organizations and individuals that came together over this past year to help us with this research, development, and design work to develop the blueprint for the Chicago region-wide CIE. None of this work would have been possible without the generous support of our local government partners, from the Cook County Bureau of Economic Development and the Chicago Department of Public Health, and participation from the City of Chicago Office of the Mayor and Cook County Department of Public Health. They all served on our oversight committee, and it really accompanied us through every aspect of this work. I could go on, but let's listen to them and their reflections on their experiences during that period.
Having worked in the housing world, but also having done some work in the IT world around, trying to coordinate IT systems in other contexts, I really saw the possibilities of how the CIE could create systems change, true systems change.
But I think that use case that had already been identified for the CIE really hit home in a different way for me, where I could see how having access to a system and having a centralized method to collaborate across hospital systems, healthcare providers, and social service providers, that just became much more real in terms of what the potential can be for a CIE to solve for that problem for the caseworkers, solve for those discharge workers, solve for that client. So that really brought it home for me.
The concept of a CIE was new to me when it was discussed and recommended by Cook County's Equity Fund Task Force, but I immediately understood the value that it could bring to our residents and to the healthcare and social service providers in the county.
And I think what was most important for me is that we learned how to keep the voices of our residents at the center, and we uplifted them in every decision and action that we took collectively. So I think when we ensured that our decision-making approach had the voices of residents at the center, I think it informed our community co-led approach at every step.
What you guys gave them that they don't get normally is a chance to speak, a chance to be heard. And I think that's so important, because it wasn't just join this meeting with us, but you really made them feel like, I'm here, I matter. And that the homelessness population goes so often where people don't see them, or what they say, it doesn't matter. So you all made it real, definitely made it a real experience.
I think one of the things that inspired me the most was the inclusion of the really meaningful inclusion of people with lived experience in the process, and that the fact that is an ongoing part of the CIE, because I think so often we at government or even at the nonprofit level are working we don't take the time to listen to the people who are on the ground, and at the end of the day, they have probably some of the best ideas of how systems can be improved, and from their own experience. So that was really inspiring for me when we had opportunities to hear from them or hear what they had said, or even a couple times I got to meet a couple of those people who were participating. I think that just helps motivate the work for me.
Well, I think as we all work to get CIE off the ground, I think the first thing I think about is partnerships. And I think the second thing I think about is trust. And with this being a joint city and Cook County collaboration, I think we learned that when we partner together, we can do more. And I think we saw that in every aspect of the initial planning phase.
That was another thing that excited me about this project, is I feel like there's not a ton of collaboration between the city and county or cross-governmental collaboration. So seeing that happen in this project is also really important and inspiring, because we can do more together than we can on our own.
This program is going to be so phenomenal, and it's going to, I think about the new year, new challenges, and I think of the opportunity, because out of every challenge, there's an opportunity.
Right now, for me, I just want to really see those pilot use cases up and running, and not because I'm not excited about what could come next, but I feel like that's where it's gonna start to really click with me, with other people, about what the CIE really can do. And then I think that inspires the what's next with it and where do we go from here?
I'm excited whenever I see the roster of participating organizations, that we have a technology vendor in place, that specifications are in place. And I am just excited to continue engaging with the implementation structure as we build out this ambitious initiative.
I'm looking forward to the time when the Chicago region-wide CIE is up and running, that our residents can opt into the CIE and spend less time focusing on finding the right services and more time on addressing their own needs, and that our excellent healthcare and social service providers across Cook County are better able to coordinate their efforts and can focus more of their time on bringing their expertise and services to our residents.
I see the CIE as an opportunity for us to build a village around this work that focuses on the intersections of health, healthcare, and homelessness. And as we think to the future of what CIE could look like, and envisioning how something so simple as data and information through a privacy-preserving framework can enable us to deliver better care to people when they need it most. And so I think there's potential for us to build upon our first focus in addressing homelessness and expand to other areas.
So yes, big thanks to our oversight committee and everyone who participated on that. But a lot of the work really came from a lot of the organizations and individuals who served on our work groups. So we also want to take some time to thank them for their generosity of time and spirit across the different work groups, including, and you'll see here listed, the prisons with lived experience, pilot planning, legal framework and consent, data standards and technology, and business planning and sustainability. But as you've heard already, there's a special place in this project for people with lived experience. These individuals are, as the slide says, at the core of this work. And we were really pleased to be able to have them as part of this project from the outset. They will continue being part of this project. They will serve on the CIE board. And so this is not an advisory commitment and some gift cards and thank you very much. And we'll take a picture and it'll be great. This is an ongoing involvement where we're meeting independently and collaborating with the work groups and them, and that they have their own work group and ability to participate in those parts of the governance and planning moving forward. So special thanks to them. But let's take a look at all the other folks who participated on these various work groups. We would need another hour just to cover those individually if we called everybody out by name. So thanks for the ability to show them all in mass. They did an amazing amount of work in and over that year of planning. And the final outcomes of those work groups' efforts resulted in a set of findings, themes, and recommendations, including the lived experience group pointed out that they wanted to continue being part of this process, and we want them to. They are at the core of the work. That we create space for them in the conversations, but also physically in the governance. So creating seats, permanent seats for them on those that they can participate in is important. That we continue regularly scheduled quarterly or monthly meetings with them to keep them connected to the work, and that we stay connected to those organizations, those frontline organizations doing the work as part of the governance of this process and the decision-making on where we move forward. And importantly also, and this is important when you hear it from people with lived experience, recognizing the intersectionality of all these issues that they serve, that they experience, but also of who they are as people, and that they are, not just, African American males or Hispanic females, but their mothers, their fathers, their parts of households, and that they have a connection, a human connection to the people that they work with in these organizations. The pilot planning group was super important. You're gonna hear from Ed here shortly about those pilots that we have planned. But the important thing that they wanted us to stress over and over again was it has to be a cross-sector collaboration moving forward. No one sector has solved this problem to date, and no one sector will solve it moving forward. These are not people who have issues or problems. They have all the problems or all the issues happening simultaneously. It's going to take a combined and collaborative, coordinated effort to address them. But that the service models should be user-centric. They should be about the persons experiencing these issues, and those folks should be part of how the care plans and the systems that they move through are developed. So keeping that person-centered is important. And then finally, capacity building for partners. We have a lot of people in organizations, small community-based organizations, providing a lot of this direct service at, underfunded, understaffed, volunteer-run budgets. And we really need to work together as a system to build up that sector and support it, because it could easily not be there and none of this work would be possible. I'm glad to say, I'm proud to say, I was able to partner with Ed Stellan, who led our business model and financial sustainability work. And that was really, spending a lot of time figuring out what are the value propositions for this work. Not just, can we have some money to build a thing, but why would we build this? What value would it have? Who would it have it to? And really, creating these each for things like Medicaid payers and healthcare and the social service sector, people who are already doing work that we could scaffold on and contribute to growing the work that's been done in the region. Also looking at successful models like San Diego CIE, which has been around for over 10 years and was the founder of the CIE movement. They've written the book. What did they learn and what can we learn and implement immediately and grow upon to be as successful, if not more? Importantly, engaging with Illinois Medicaid health plans, as well as the state, to support things like the waiver and any other programming that they have, and make sure that the CIE is seen as a part of the infrastructure that supports all this important and good work. Aligning, that takes alignment with other efforts. And, finally, looking at where philanthropy is already working in many of these fields and how the CIE can support and align with their work, not just ask for another handout. Finally, the legal aspect of this is super important. We've taken a people and equity first approach in this work. And, the inclusion of people with lived experience has been super important and has been at the center of how we do things like consent management and who has access to the data for how long, for what purposes. So all of these things have been included in the recommendations from the legal and governance framework. Finally, the one work group that we are not going to discuss here, because we're going to have some guests speaking about that, is the selection of our solution partner. That is for Medica and Well Connected, and you're going to hear from them here shortly. But now that you've heard about the last year and how we got here, and this, the plan, that was the blueprint that you just heard. Let's talk about what you can expect to see from us as we begin our implementation phase in 2025 with our pilot organizations, our partners, and our founding CIE staff. So you're going to see a new organization and a new organizational structure that takes the work of these former work groups and now translates it into an organizational structure that will invite folks who had been on some of those work groups to join, as well as new partners, and create new opportunities for this governance to be a collaborative project with us. You'll learn more about this as we have other meetings and webinars, but as Ed said, feel free to reach out and ask us how you can participate in this new organizational structure. This structure is going to be started by our pilot organizations. And again, Ed will touch on the pilots here shortly, but our pilot organizations have agreed to participate in the 2 pilots that we will have this starting this spring to start the network that will eventually grow to be the Chicago region-wide CIE. Our partners are listed here, and we have a staff that will. You've probably interacted with many of these folks. They're on the call today. This will be the founding staff of the CIE. They'll be working with those partners, and they'll be working as part of that new organizational structure to bring the blueprint for the CIE to life. So if you haven't met these folks, you will be hearing from us as we move forward. But finally, let's talk about that technical solution and our partners at Formedica and Well Connected. They are, they represent our team on the solution side, and it's my pleasure to introduce Greg Church and Dwayne Connor.
Waldo, thank you so much. And I'm so excited just listening to this discussion today, and Crystal and Ed and Waldo and Andres and the folks that we've already had the pleasure of working with. I have to say, as president of Formedica, when we heard about the initiative and the opportunity to respond to the RFQ, I couldn't think of a better partner to pull in, which is Dwayne Connors on the Well Connected side. We've been leading Formedica for 26 years, how to improve healthcare data exchange, really thinking about the person as being the most important to bring them into their journey of healthcare. And when you think of healthcare interoperability and what's happened over the last couple of decades, you really have to think about identity management. You have to think about data privacy. You have to think about consent. All of these things that we do every day. A lot of people say it's just tech, but there's more to it. Tech has to be really thought through carefully because it's what we embrace and actually put out there. And it's what we do with the data that matters. So our whole focus has been around the healthcare interoperability side in our 26 years of doing this. We bring a lot of experience and a lot of use cases to this project. We've been doing healthcare data exchange with other states, at scale. And we can do this with, really high precision of how data gets managed correctly. We're very committed to this project, and we're dedicating a really incredible team of clinical experience, technical experience. We've been able to bring our platform together with Dwayne's product that you're going to hear about here in a minute, where we're going to be able to bring both clinical and community data together in one secure data sharing environment. And we really want to stay focused and learn and listen from lived experiences, as well as the team that's here and the expertise, how to really bring the best-in-class Chicago region-wide CIE, not only to Cook County, but hopefully as we expand beyond Cook County, because I think the entire state can benefit from such an important initiative. So I'm very excited to be here. I can tell you my team that's part of this project, their enthusiasm is excited to get the project kicked off. And I think at this point, what I'd like to do is have Dwayne share a little bit more about the community side of what we'll be doing together.
Thanks, Greg. Thanks, Waldo and Ed and Crystal. Thanks for having us here. And we are extremely excited about the work that we get to do with everybody on the call and in the community. They're in Cook County, Chicago, Illinois statewide. A little bit of background on who we are. So me and my whole team are generally experienced and recovering healthcare administrators or professionals up to a varying degree. We had set out to build to bring modern technology to community-based organizations and non-hospital-based care providers, originally just across New York State. We realized we had been doing the same thing over and over again, which was a lot of data curation and standardization, building dashboards, taking information from notebooks and Excel sheets and Salesforce, kind of combining them into places that were made reporting easy. So just after the pandemic, we decided we should just build the solution that made it a lot easier for community-based organizations to focus on mission and really deliver support care in a collaborative manner, but all in one place. And that's where Alco really came from. We built it with 15 CBOs over the course of 18 months, understanding trust and workflow and legal and consent, as well as the varying different ways that everybody collects their information, but how they then all have to report it to whomever it is that funds their missions or their services and things like that. So we're really excited to be part of this now that we now cover New York and New Jersey and West Virginia and now Illinois. Really being a ground tool set, and it's a full case management suite. It is a full digital referral network. We do partner with 2-on-1s and anybody else who has curated networks that we can join in a federated manner, to really allow every community-based organization to support those members with and alongside digitally everybody else in their community, identifying appropriate resources at the right time and connecting with them no matter where they live, and finding that correct thing for that intervention when needed. And we're really happy to be partnering with Greg and their team to integrate that health information into that social care record for community-based organizations in a really cool and intuitive way that I hope all of you get to see when we start implementing it and going live there in Cook County.
Yeah, and I would just like to, follow up and echo on that, because for our vision, as partners for Medical Well Connected, we're really here committed, to helping improve Cook County healthcare access, quality care outcomes, and of course the social needs that are so needed. And we bring, combined, years of experience, 25 plus years. I think that's important when you look at it from a technology perspective. We're bringing innovation, we're bringing modernization, we're bringing well-connected community reach model together. It's a cool model because it's CIE, but it's also healthcare. And what a great way to showcase, how you can bring data together more meaningful. And what we're going to strive for with a lot of leadership direction and support from Waldo and team is that improved care coordination, helping to bring that patient experience, that lived experience more into reality, giving everyone the transparency that they need through a platform. So we're really excited, guys. And again, thank you for the opportunity to be here today to introduce our two companies.
All right. Thank you. Thanks so much, Greg and Dwayne. And thanks everyone for all that you've talked about today. So I'm going to talk a little bit here about our pilot launch that's coming up right around the corner here in the spring. We are working with our pilot centers on a couple of things: shelter-based care for people experiencing homelessness and medical respite for people experiencing homelessness. And often people will ask me, well, how did you come up with those pilots? And it was really easy. During the pandemic, the county, the city, others convened folks to really look at the needs of the most vulnerable people in our city and our county. And throughout all those conversations, a very common theme arose, and that was we need to do better at sharing information across sectors, across systems, because we're dealing with individual people whose needs are complex, and the services to address those needs unfortunately fall into very siloed systems that don't coordinate or talk with one another. And so hence the community information exchange, really a person-centered longitudinal record to follow people through their journeys through this social service and healthcare environment. And so, 2025 spring, we will be launching the CIE with our partners in medical respite and shelter-based care. We understand, we've already engaged them, and we understand their view of the world being that they need to help their folks be connected to services that address the social determinants of their health so that they can achieve good health outcomes. All right, so we can move forward. You've heard so far from folks who were involved with the oversight committee, but we've been also throughout this time working with folks in the our partners in philanthropy and others. So right now, I'm going to turn our attention to a video from Tamika Christian of the Pritzker Family Foundation.
And so when we heard about the work of the CIE, we thought it was a good opportunity, one, to look at a system that could create, or there was an opportunity to create cross-system alignment that would give us the chance to look at what is happening in real time to individuals as they are working from or moving throughout these systems. And so what we know is that individuals that are experiencing homelessness, their lives are complex. And they are they're a very transient population. So one day they could be in an emergency department, and the next day they could be in jail, and the next day they could be in a shelter. And so I think the CIE gives the opportunity to really lean into what is happening with individuals in real time and create and improve outcomes for those individuals by creating a system where systems can talk to each other, they can link together to be more effective and efficient to improve the quality of life for those individuals that have a lot of complexities. We focus on public health measures, but through the lens of population health. And so, for example, some of the populations we serve are those individuals that are frequent utilizers of crisis systems, but we also support the LGBTQIA community. We also support mothers of young children or who are pregnant that are experiencing homelessness. And so we see the CIE as a cross-cutting way for us to support our work, and our internal strategies in a cross-cutting way, and specifically leaning into making sure that those individuals are connected to the right sources and resources to improve their individual needs. We are a data-driven foundation, and we look at data as our friend. We also know that data isn't easy to come by, that we really have to work and build relationships to have connections to meaningful public data sets. And so the CIE hopefully will lend to a more centralized, comprehensive way of addressing the needs of those that are experiencing homelessness and the existing resources that's available. And so in addition to being, looking at the CIE as a centralized way of housing data and resources for those that need it the most, we also understand that data can inform us on identifying gaps and needs, in the service ecosystem around homelessness. Once fully operational, the CIE would be able to help individuals navigate and get connected to those services that they need the most, whether it be through, public benefits or workforce development or behavioral health or substance use treatment or getting connected to FQHCs or other healthcare services and support. And I see the CIE building that alignment piece and providing that warm handoff so that individuals aren't left navigating services on their own and having to, connect the dots for themselves. I see the CIE as a dot connector through that service provision lens and making sure that individuals are getting connected to the services that they see that they need and that they need, and to continue to help them navigate through that process through warm handoffs. I would just highlight and add that one component that is also intriguing to us at the foundation is all of our strategies have built in the voice of individuals with lived experience. And so the CIE being co-created through the lens of community voice alongside systems change partners and practitioners is a really innovative model where, lifting up community voice is the center, and making sure that the system is designed around those who are going to use it the most, I think is a genius of the CIE, or a brilliance that the CIE brings, the CIE will bring to the state in a way that we've never had it before.
All right. As we work to build and implement the CIE, we're looking at this from all different kinds of directions. And we want to be sure that we're knitting together different folks from different systems and different sectors. And so next, we're going to hear from a representative from the Illinois Association of Medicaid Health Plans, because we know how important these social needs are, and connecting folks are to good health outcomes. And so we will hear from Rachel right now.
Community partners are crucial to improving the health and quality of life of Medicaid members. So in Medicaid managed care, we understand that the health of our members is not just tied to their medical care, but also to addressing their health-related social needs. So that's things like housing, nutrition, and transportation, and more. And creating relationships with community partners and resources that address these needs can help the NCOs better coordinate their care for the patients and support them to thrive. So for example, if you have a member who needs housing and they're unable to access housing, that may also impact their ability to refrigerate any medications that may need refrigeration. If they lack access to transportation, they may not be able to attend their doctor appointments on time and get the crucial care that they need when they need it. So collaborating with community organizations that can bridge these gaps and address these health-related social needs really supports the patients to thrive. And as Medicaid managed health plans, we are happy to try and collaborate with these community partners so that we can coordinate that care for the patient. Medicaid managed health plans strive their best to locate members who may be lost to care. They leverage contacts and information provided by the state, as well as updates from providers and community partners where possible. But we also know that the members who are the most challenging to reach are also those who may have the greatest need. So members who may be accessing emergency services or accessing services by community partners that may not be in our network or in our knowledge. And we may not know that our members are accessing these services. And so building greater partnerships and being able to exchange information with these partners may support us in furthering, getting them back into care. And that is one potential benefit of community partners with the health plans, to ensure that they are getting connected back to their health plans so that we can further address those needs and connect them with other community partners, as well as with healthcare providers, to ensure that their whole health is being managed and being addressed. In the state of Illinois, the 1115 Healthcare Transformation Waiver was recently passed, which does address health-related social needs. So that includes people who are experiencing homelessness or who may need to be linked to housing or to medical respite care, as well as those with nutritional needs, transportation, both medical and non-medical. And then it also has a benefit for those who are currently incarcerated, who are transitioning out of incarceration. And these benefits are incredible because they do just that. They address the health-related social needs of the member. And so these services coming into the fold in Illinois Medicaid are great because they are accessible to Medicaid managed care members, and they'll better support the health plan to be able to manage the full care of the member. It will also, encourage community partnerships with organizations that provide these resources and supports between the health plans and those community organizations, and help to build more systems of support as opposed to individual partnerships that will build more systematic support and systematic care to ease those transitions for members who have more complex and multiple social needs. It will also encourage information sharing amongst those organizations, which again will improve that coordinated care.
Okay, now as we come into the final stretch of our time together, our communication strategy, I'm just going to really briefly go over this with you. We will be developing a new brand identity for the CIE. That's coming soon. We're working on that now. And we already have a website. It's up and running, but we're working on freshening that up and getting it updated for everyone. And finally, I really, really want to encourage people to sign up for our newsletter. It's a terrific opportunity to learn about where we've been, where we are, and where we're going. And here's some links to both the website, but also a link to signing up for the newsletter. So I'm going to close us out with a big thank you to everyone who joined us today, and thank you for spending some time with us. I hope at the end of the day, I hope that everyone sees themselves in the CIE. It is our CIE. It's been made crafted from the voices of so many different people. And as we move forward, we need everybody's voice and everyone's participation. So we're grateful for your time with us, and I will close that out right now. Thank you.